Hello, and thank you for joining us for this very important conversation, centering Brownsville and the response to the COVID-19 pandemic. This BRIC Be Heard Amplified Town Hall, in collaboration with Brownsville NeON and the New York City Department of Probation, will really focus on the community's response and the challenges ahead as we recover and become fully intact from the COVID-19 pandemic. And without any ado, I'm going to introduce you to our four panelists right now. They are Deputy Mayor for Strategic Policy Initiatives and the co-chair of the Racial Inclusion and Equity Task Force, Mr. J. Philip Thompson. Thank you for joining us, Deputy Mayor. I'm also happy to welcome back to Town Hall, as we are welcoming back the Deputy Mayor, Dr. L. Toni Lewis. She's the founder and president of Liberation Health Strategies. Thanks for joining us again. And another face that we are very happy to welcome back to our airwaves, Ms. Monifa Bandelli. She's the senior vice president of Moms Rising. And to make us complete, I'm happy to bring the principal owner of 11375 into the room, Anita Pierce, Brownsville Strong. All right, our community is here. I'm going to invite you all to unmute because we're going to have a free-flowing conversation like our people do. Brownsville is facing this pandemic and staring it down harder than almost any other community, certainly in New York or even the country. So if we're going to work on a plan and a roadmap for restoring Brownsville to better than it was before, tell me one thing from each of your respective points of view, and I'll start with you, Dr. Lewis. One thing that has to be a part of that recovery plan.
Thank you so much for asking that question. And I'm so glad to be here with my family and friends. You know, I got to turn one into two because there's always that kind of back and forth. So I'm down with, we have to invest in the brilliance and strategy and resilience of community partners that are there and have been doing work and have survived multiple things before. But that also means we got to, divest from the things that have harmed and hurt people in Brownsville, all the panic and neglect and the issues. So yes, invest in our dopeness and divest from the things that harm us.
Anita Pierce, Brownsville, born and raised. I see you shaking your head. You're always ready to help us get our money up. What is the number one priority from your perspective that we should be as a component of a recovery plan for Brownsville?
I definitely want to say first, thank you for inviting me to be on this esteemed panel. And I couldn't agree more about investing in our dopeness. Thank you, Dr. Toni Lewis, for that. It is important from the perspective of where I sit. I am a Brownsville baby, native. And one of the things that I continue, especially as I lend my experience, is really, understanding and embedding into our tools and resources that we are really educating one another. Sometimes when we think about, what education look like, we know that there's systematic racism that does have an impact, but the importance of all of the local community-based organizations, entrepreneurs, general moms and dads who actually live in Brownsville, is making sure that there's really true access to information. In order for us to be able to grow and thrive.
So Monifa, one elemental thing that has to be a part of any recovery plan for Brownsville post-COVID-19.
Well, my mantra for all these issues is that we have to get at the root. The pandemic exposed already glaring health disparities that exist. So what we have to do is really dig deep and go to what is the source of why we are affected disproportionately across the board with all of the various diseases. And it's because of neglect, medical apartheid, the racism within the healthcare delivery system, the employment system, the housing system. And so we have to be able to really zero in and identify the factors that existed before the pandemic that put us in this position in Brownsville and all over the borough, and really in Black communities all over the country. And so that means naming it. We have to name racism, and we have to have race-specific solutions that are grounded in equity, because if we kind of have a race-blind solution, the health disparities will stay after COVID is gone.
Mr. Deputy Mayor, start at one for me.
Well, I agree with everything that's been said. I would just add jobs and employment and income. Underlying the racial disparities in health are the kinds of stress and trauma that go with being in poverty or not being able to pay your bills every month, worrying about that, worrying about where you're going to live. Those conditions produce stress. Stress produces hypertension, produces diabetes, even cancer. And Black folks have been living in trauma, as Monifa Bendelli said, well before COVID. COVID just brought it out into the news, but Dr. Lewis and I were actually working with Interfaith Hospital in Brookdale and a bunch of community health advocates years and years before COVID, and Brownsville was the center then of health disparities, and Brownsville was having dozens and dozens of excess mortality. It's called people dying who shouldn't die every month before COVID. So that's one of the things I would just bring up as well.
I'm wondering, now that the world is waking up and finding out what people who know and have known for a long time, what is the process of turning that knowledge into action now in a way that moves the needle in Brooklyn in general and communities of color that are dying more than anybody else?
I'd love to circle it back to what Dr. Lewis said, which was the invest, divest, right? So we're looking at the systems that would help us to not have these comorbidities, our health and hospitals, our emotional and wellness systems, our education systems, the employment systems, all those things that the Deputy Commissioner named. They have really, really small budgets, right? And we're living in a city where the police budget is $6 billion. And so our budget is a value statement. There has to be a shift in the values of the city so that we're really investing in these systems that we know are going to close those gaps. And we won't have to be looking at whatever the next pandemic, whatever the next health crisis is, that will still be at the top of it. So really a huge shift in investment. And I think it starts now. You know, while people are in the streets, people are demanding these investments. And so we need to strike the iron while it's hot.
Thank you so much for that, Monifa, because I love that you mentioned the emotional kind of health and wellness piece, because, you know, all over our neighborhoods and all over Brownsville, there exists these kind of small businesses that tend to the mental, physical, and spiritual health of the community, you know, with a small business frame, with ancestral and culturally like relevant and respectful techniques. That, to be clear, we're on the front lines of all of this when people could not get to a vent or a hospital or anything else. So while there were all these kind of, you know, press conferences about how you need to find your doctor, we were talking with, you know, our healers who were, you know, doing herbs and doing breathing and checking in on folks and visiting elders. And so like a strategic investment would be that those folks should be poured into to like continue to create an ecosystem versus having to struggle to look at like, you know, month to month, day to day, the bills of things. And actually at this point where, you know, our system, the healthcare infrastructure as it is set up now is not fully staffed, fully equipped to meet the need of addressing racism. And I love it's racism, not race, right? That's causing these issues.
And now we're happy to welcome back to the Be Heard Forum a former panelist, Lisa Kenner, a longtime Brownsville resident, as well as an activist and tenant organizer.
Good afternoon. My name is Lisa Kenner. I am the TA president of Van Dyke Houses. And I want to remind people, COVID-19 is still out here and we must wear our masks, especially our young people. Even though it's the summertime, please put your mask on your face to protect yourself as well as your family members, because we are a community, and if one get hurt, all get hurt. So please wear your mask. The Governor Comad gave us masks. We still giving out masks and hand sanitizer. If I see you in the street, I do have some in my pocketbook, I will give you one. So please wear your mask so you can stay healthy and safe and blessed. Thank you.
As Monifa said earlier, budget really reveals priorities. Mm-hmm. And I'm looking at you right now, Anita. I know that you're a member of Community Board 16, and almost 3 months ago, you all instituted a COVID-19 committee that was really focused on mobilizing the human resources that are at hand, even when the money isn't coming through as we would hope it would flow. So I'm just wondering, how is the community self-determination coming into play at the community board level?
One of the narratives that we believe is that, you know, the person on the white or black horse isn't coming to save us, right? And so we collectively, myself and a number of community-based organizations, residents included, have decided that we were going to start taking back, you know, some of the ownership, that we're going to start doing some of the work ourselves, because we know and believe that, you know, if we start to internalize our process and show people what it is that we can offer, that they will then, you know, eventually realize that this is something, you know, that they can eventually partner with and will help to help sustain it long term. You know, at the community board level, yes, we have been meeting and have formed this committee, something as small as the language, right? You know, when COVID first hit, we were like, what's social distancing? That's not a language that really, you know, it doesn't sit with us. So we actually came up with, you know, understanding, you know, how to speak the language of those who live within our community. Physical distancing, you know, understanding that we need to, you know, share, have this distance engulfed with love. And so we came up with, you know, and developed our own flyers that we circulated within our community. This was done when there was food distributions. We made sure that we had that information done. So definitely, you know, just taking those little steps and making sure that we own and not wait for anyone to come and save us is the mentality that we have now. Because right now, if we wait for anyone else to do it, it won't get done.
Deputy Mayor Thompson, knowing, as Anita just pointed out, the folks aren't waiting for that white horse to pull up. But if a horse did pull up, it might foreseeably have something to do with your portfolio of what you're managing with the city. I'm wondering, in the middle of the defund movement that's happening right now, how those dollars might be used to help energize and change some of the health outcomes in a place like Brownsville.
Well, let me just step back for 1 minute, because someone, I think it was Monifa, mentioned that there's a national movement going on right now.
Yes.
The federal government stopped building public housing in 1972. It stopped adequately maintaining public housing that was already built in the 1990s. And we have not had a federal program to really support housing for people in need in many decades at anything close to the scale that we need. And New York pays more federal tax money than we get back by tens of billions every single year. And the federal government is the only part of government that can literally print money. So while we definitely focus on the city and the state and those resources in terms of investment, the really big thing is the federal government. We can talk about $6 billion at NYPD, but that doesn't even compare to what we're spending on military and all kinds of stuff at the federal level. So I just want to mention that, because we as Black people have not come together. I'm yet to attend a national gathering of Black people, a Black Congress or whatever, to say, what are we demanding from the federal government, which we all pay into. One. Two, right now, New York City is over $9 billion over budget. We are spending $50 million a week just on food because so many people lost employment that they're hungry. And $200 million a month. The state Senate has refused to take up the House bill to reimburse cities like ours for the expenses, the money we're spending for COVID-related things. We're trying now to get permission from the state to borrow $7 billion to keep things moving. There are a lot of things, I agree totally. We need to focus on the budget, focus on investing in the communities that have been hurt the most by COVID, that were most in need before COVID.
Right.
We need to do all of that. But right now, both the city and state are in fiscal freefall. And when money does come in, all of us need to pay a lot more attention to where it's going.
Well, that's the reason all four of you are here today, because we know you are people who do dig into the details.
Can I jump in a little bit, Brian? You know how I love to do.
Go ahead.
You met me. I'm sorry. I appreciate you, Brian. Is it okay?
No, please.
Okay. So I just wanted to say, and I am saying that, like, we deserve all the things, right? I mean, that's what happens in terms of, you know, when we talk about whether it's a reparations frame or a divest invest frame or just a life and death frame, because the lived experience of my community, you know, whether it's Bed-Stuy or Brownsville, you know, or just Brooklyn or Black women or Black people, is that what we've seen and felt over the last couple of months is, you know, as Anita was saying, language that didn't really resonate with us, stories and feelings of loss and death. I mean, people, we could all do more than two hands of people that died. But then all of a sudden we saw all sorts of money come in terms of riot gear. You know, I know the Brownsville Community Justice Center was passing out stuff to people and had police stopping their vans. And so the way we've experienced the budget and the city's priorities has been more kind of in those palpable spaces than the things that we needed just to live. And so in that, I think that has to be accounted for in terms of, you know, as Monifa was talking about, like the way we discuss budget and think about budget, and it's, you know, kind of the moral contract. And also the way Anita was talking about how, like, you know, we do our self-determination, like we know who we are. Like I love, a friend of mine actually posted something the other day that every Black person you run into is a miracle. And so I just wanted to lift that in the continuing conversation, because I hear you, Deputy Mayor Phil, because, you know, we've known each other for years and we all know what budgets look like from the global scale to the household. And we know when there's a will to move, it moves. It doesn't, you don't really need to do that much negotiation. So.
Yeah, I want to say I agree too about the details and where that money
always
comes
the
from.
details. Mm-hmm.
And you know, I think some of the numbers are pretty shocking. I mean, just last year, the NYPD paid $70 million in settlement cases. So that's not, you know, to get rid of that number, it's not about laying off people who were hired more recently, but, you know, who's committing this abuse that's causing the city $70 million in 1 year? And what kind of things could Anita and her task force do with $70 million a year in Brownsville, you know? So I think when we really dig, I think we do need to pay attention to details and look beyond the personnel costs, because there's a lot of other costs there and there's a lot of excess there. I did also want to go back to how, you know, not just the money investment in the resources, but then there's also like political power investment. Right at the beginning, Dr. Lewis said that, like, the people of Brownsville already know what they need. They already have the genius, you know. It needs to be scaled up, and they also need to have the power to execute the solutions that they know work for the communities and not be blocked, you know, from a top-down way. So, you know, it's money, but it's also money and self-determination. You know, the political power needs to happen so that we can change this framework for all of Brooklyn.
I agree with what's been said. I just think if we're going to look at money, we ought to ask the question, why in a state with an $80 billion a year Medicaid budget, half of it coming to New York City, we have people in Brownsville who are suffering the kind of health conditions we were talking about earlier, and CEOs of nonprofit hospitals surviving almost entirely on public money, making $10 million a year personal. So if we want to start looking at money and where the money is, I'm all for it. But I'm just saying, let's really dig into that. Because
so I'm sorry, Deputy Mayor, but on the steam of that, I remember when you joined us to talk about economic inequality, and you talked about the caregivers that were there for your mother's end of life care and the fact that they were receiving minimum wages, and just even further expanding that with the knowledge that by one study that I read, only 1 in 5 Black people in America have the ability to work from home, knowing that we have been frontline workers for a long time before that was a thing that was reframed by a pandemic. So if we're looking at this thing systematically, as we've been urged to do, and I got a community board member here, and we were talking about how the feds haven't even fully funded NYCHA in a very long time. What system do we attack from where we are now in just a sort of prescriptive way?
I would just say, I think Anita said it. I think it all starts with organizing. 1 in 2 people in Brooklyn are on Medicaid. 1 in 2 people in the Bronx are on Medicaid. There is not a single organization in New York City, New York State, or the United States of America that represents people on Medicaid. They have no voice in the system, even though this is the second most highly financed system in the state after education. There is nothing. And so I think it starts with what you are doing right now, us educating each other, organizing, and then fighting for a voice. And then after that, I think we can begin to pressure for the kinds of changes that folks here are talking about. But it starts with organizing.
So I like to add, in addition to organizing, is making sure that we level the playing field in terms of bringing individuals to the table that we're truly looking to impact. I've been a part of a number of conversations, especially as we've been in this pandemic. And oftentimes my question is, who are the people that we're looking to serve and why aren't they at the table? We are, in this virtual platform right now. I have had the honor and actually a privilege to be able to create, host, and develop something called the Brownsville Minute. What does that mean? It is a platform where, we have decided, again, to utilize the voice of the local people who are in the community to be able to not have a script to describe what's happening, but to be able to share their real experiences while they're in this pandemic and to come up with some of the solutions, particularly as it relates to economic mobility and connecting the dots to all of the social economic things that we know are connected. So we, again, have decided that this was one of the ways to close the gap on informing from trusted messengers, because oftentimes when we hear messages, it does not reflect the faces that exist within a community. And I want to bear that to be repeating because, again, we are supposed to be servicing and providing resources and drilling it down to, the everyday neighbor, whether they live in NYCHA, because everyone does not live in NYCHA and Brownsville. We have a full makeup of individuals, residents who love Brownsville and who love where they live and are really looking to create and enhance, some of the things that we actually don't have and want to see. So
at that point, Anita, I'm gonna look at, we're running up against our last 2 minutes, if you all can believe it. So I'm gonna pull a King Solomon and judiciously split that between Ms. Bandele and Dr. Lewis. So Monifa, if you have a message about bringing more people to the table who aren't represented.
Oh, I'll just plus one what Anita said.
Okay.
Because what she's saying is central, and so I'm falling in line behind the Brownsville leaders, and that's what's needed on every level.
So Dr. Tony, in the last minute, the most unfair question I'm going to ask today is for you to write us a prescription, knowing that there's a need for fresh food access, knowing that we have higher levels of all kinds of co-morbidities and divestment from the federal government in our community. What is the prescription for getting Brownsville well on our terms?
Trust Black women, listen to Brownsville Genius. And I'll just underline that a little bit more. So Deputy Mayor Thompson, you remember when we were on this town hall together last time about economic inequality, we talked a bit about how it makes sense for folks within power to create the space to hear the voices, to talk about what needs to be done. And it always triggers me a bit when folks are asking for additional labor from people who we've all just said are dealing with all of the inequalities and inequities. And there are folks like the Brooklyn Rapid Recovery and Response Team, BCJC, Combine, the Health and Wellness Table. We're organized. We know we can create the space and invest in. Please don't ask for task force to do all this work for free when we're already working for money. So I think that's really it. Trust, you got 3 Black women here who could easily pull together a group of folks to tell you what we need and put some numbers behind it too. But the prescription is to just love each other well and listen and invest in that dopeness.
I'd like to again extend our sincere thanks to all of you for joining us. It really made an impact. Deputy Mayor J. Philip Thompson, we appreciate you being here. Dr. L. Tony Lewis, we appreciate it. Monifa Bandele, and of course, Anita Pierce. Thank you for joining us. And now we're going to close with a word from New York City's Commissioner of Probation, Ms. Anna Bermudez.
Hello, everybody. Thank you for having me as part of this panel and this discussion. It's an honor, and I want to do some thank yous first before I say what I would like to say about the conversation. To BRIC Media for providing this platform, the expertise that you bring, and not to mention the enthusiasm of everybody who put this together. This was phenomenal. Deputy Mayor Thompson, always a pleasure to be with you. Your commitment to all things NeON, and you have been such a champion of our work and our equity efforts. And it's the stakeholder groups also, and our staff. The Brownsville stakeholder group, some of whom are represented here, even though officially the state was on pause, you never paused about anything. You were in it, doing everything that we could, for the Brownsville community. And I have to say that the biggest thing I want to say is thank you to you and to the Brownsville community, because you've let us probation, okay, of all government agencies, be a partner and be part of your dopeness and to contribute to your dopeness. And we are eternally grateful for that, because you have always pushed us to put our money and our resources and the opportunities where our mouth is. And that is an integral part of being able to move forward. So my call to action today is to start thinking about NeON Health. Let's think about how to have the community make decisions about wellness in the Brownsville community. Yes, for that we need some money, but hey, we're gonna try to figure something out, and try to do increased investment into that part of the community. So this cannot be a moment in time that then floats by and then it fades away. We have to take matters into our own hands, as everybody has said. No matter how small the project, no matter how small, we can create a wave, we can create a movement and get things done. So thank you very much, and let's keep moving.